Welcome friends to our 11th week lectures. As I promised, we will have a dedicated lecture on econometric modeling in health. So, before going into the depth of this, I think it's required to have a brief recap. We especially discuss on issues of healthcare through data. And we emphasize the sources, importance, micro and macro dimensions and indicators, and also we discuss about the challenges and limitations. Here, understanding the data, as we mentioned as the first step in doing any econometric analysis, the next step is a specification of the econometric or regression model and appropriate estimation techniques. Hence, in this lecture, we will learn introduction to econometric modeling used by applied health economists. In the econometric modeling, we will discuss about linear regression techniques and nonlinear regression techniques. We also briefly discuss about research designs in causal inferences or causal analysis, where the RCT, famously known as randomized control trial, and the quasi natural experiments. So, the pure form of experimental design is called RCT in social sciences, largely used, but health professionals apply as clinical trials. But since our domain is social science, since we are focusing on social issues of healthcare, hence we are focusing on randomized control trial for the explanation. And randomized control trial will emphasize that how difficult it is, how expensive it is, etc. Hence quasi or natural experiments are also suggested. Then the last one to emphasize is estimation methods. So, in the introduction, I wish to explain econometric model describes the key relationship under investigation. That is, we have microdata on a sample population, and we are interested in understanding the role of education in determining the differences in health across populations. In order to do so, we can think of a model understanding the relationship between education and health of ith individual, that will be presented as yi alpha beta 1 x 1 I 1 and plus x prime gamma plus epsilon or error of the ith individuals. So, this is presented in matrix form. So, you can refer this form from the book Green, William Green, for the econometrics. So, y is our dependent variable here when we say its relationship with education and health. So, we are actually referring to the measure of health, maybe blood pressure, maybe many other indicator with any morbidities indicator, etc. Whereas the first small xi refers to the primary factor which we want to emphasize, that the primary independent variable which can be proxied by either year of education or highest level of education or individual attended university, etc. Since our focus is on education and health, so we have to first emphasize on this variable. Then other set of control variables are also required. Those are simultaneously impacting the healthcare along with education. There are multiple relationships. Yes, we just said these, that does not mean others are not impacting. Okay, these are also impacting, hence we need to cross check with how these have also some relationship and these have some relationship. Okay, and how, but over the time period we are not discussing at this moment, that refers to the aspect of time series component, we are not, or the serial correlation, etc. we are not discussing at this moment. But I am just giving you signal, those who have already read econometrics to some extent. Hence, all those relationships are going to be emphasized. We need to also cross check how these two are also related. Okay. So, by all forms, let us emphasize at this moment about x prime, the capital X, that is all about vector of other explanatory variables associated with blood pressure such as age, sex, dietary quality, etc. Because since our purpose is to discuss about y hat. So, the estimated value of y is also dependent on the dietary quality, the sex, age of the person and other demographic features as well. Finally, the model usually possesses error terms. So, error term captures all other determinants of blood pressure that are not included in the explanatory variables. So, beta 1 here is the coefficient that is in fact measuring the impact of education on blood pressure, controlling all other factors, keeping other factors constant. So, we will discuss these relationships. Let me give you just a hint. When we are actually trying to check this, we need to check whether the independent factors are actually related or not. So, somewhere you might have studied about issues of multicollinearity. Okay, so that has to be also cross checked. So, when we are saying okay, this is the one where multicollinearity issues, then whether the explanatory variables is actually linked to the error term or not, and then in that case we are actually referring to the context of some issues of endogeneity. That does mean how when this is linked, that means x and y are considered to be having some reverse causality. Okay. So, we will just check how far x is dependent on y and y is dependent on x. So, that aspect is going to be emphasized as well. Then we all need to also cross check how far this follows a distribution. Okay. If it is following a normal distribution as per the Gauss-Markov theorem, which is written Gauss-Markov theorem as per the standard assumptions of the basic or the linear regression. We will discuss everything systematically. At this moment I have just tried my best to give you some directions. Okay. Let us unfold this discussion for one by one, starting with the linear regression. So, linearity, as you might have read, linearity means it is linear with the what parameter. Okay. So, the parameter should be linear. Variables might be non-linear, but the parameter which we are estimating must have must be linear in nature. Okay. So, it should not be beta 1 square or beta 1 q, etc. Then that refers to non-linearity or non-linear models. So, at this moment the simplest model specification assumes that a linear relationship between dependent and independent variables, but the relationship should be explained with their coefficients. Okay. Coefficients should be linear. The linear model relies on several assumptions. You need to refer to the Gujarati, even the latest books can also be referred. Green, as I already mentioned, for the equation to be written in matrix form. So, the ordinary least square method is considered to be the most common regression estimator of regression, where the least square, the square of the error term, to be estimated at the very lowest level, so that whatever the projection we do it, that means error term is actually at a very low level. So, our projection is considered to be better, hence the least is emphasized. So, our purpose is to actually take the first order derivative and second order derivative of the error distribution. You can just cross check with Gujarati, you will get all those details. Ordinary, I have already mentioned, the relationship is considered to be ordinary in nature. That means a simple relationship is expected. Now, OLS interpretations are usually easy. For instance, in the earlier case which you have just cited, education and health example, if education is mentioned with a variable called years of education, and blood pressure, etc., that is the proxy of the health indicator, that is millimeters of the mercury, that is mmHg, that is measured in standard unit of blood pressure. Then the coefficient beta 1 represents the impact of unit change or unit increase in education, that is one extra year of schooling, and its impact on blood pressure, okay, keeping every other explanatory variable under control. That is why it is interpreted. Although linear regressions are useful measure of econometric analysis, however, in applied health economics research, many assumptions of linear regression models are indeed violated in practice, particularly the assumption of linearity and exogeneity. So, as I just said, the projection which we are just doing it here, y or x on y, so x would be sufficiently exogenous. So, but how to guarantee that actually variables are exogenous in nature? So, some tests are there. At this moment we are not emphasizing everything, but exogeneity, then only we can project correctly. Since there are some biasness, there are some challenges with the assumptions which have alternative solution that provides greater flexibility in modeling. Hence, we have to follow nonlinear regression, and it is sometimes referred to as nonlinear least square regression. Okay. Nonlinearity is a common feature of many applications in health economics. Generally, nonlinear models are used to specify limited dependent variables. So, first aspect, you just take a note, we have already highlighted in bold letters, limited dependent variable, that is the dependent variable whose range is restricted in some way. As we also refer the author who has mentioned clearly, most commonly found variable in health economics are usually binary in nature, basically having a choice between pair of options. For example, has a doctor ever told you that you have arthritis, with response coming as yes or no? So, its answer is binary. Similarly, there are multiple responses as well, maybe in ordinal form, maybe in nominal form. Okay. So, multinomial variables, hence multinomial regression models are also suggested. In this case, the choice between several options that do not have natural ordering are there. For example, which hospital did you attend for your treatment? So, out of the choices, if these are given, no different choices are there, there is no ordering followed, hence that is purely called the multinomial variable. Another possible multiple options are there through ordinal variable. Ordinal, as the word indicates, is called order. It follows an order, that means choice between several options with a natural ordering. For example, how would you rate your current health? With options given as to the patient, the response is excellent, very good, good, fair and poor. So, this has to be also followed accordingly in the nonlinear regression model. Another is called count variable. It is not purely continuous, which we used to see in the linear regression model. So, count variable are considered to be having some sporadic responses, which might have some lexicographic choices. So, count means it has to be in particular points. Count data typically contain a large proportion of zero observations as well as long right tail of observation. Another important aspect, we are giving example as well. Many empirical analysis on the use of healthcare services use dependent variable that represents count of the event. For example, how many times you have visited your doctor in last 4 weeks. So, it has to be in count. Okay. Then the ordinary regression model is not used. Another aspect is regarding duration variables, which is indeed measuring the duration. In applied health economics, many outcomes of interest reflect the time elapsed before an event occurs. For example, time to death, here the data are usually censored and censored or restricted, either left censored when we do not know the date of entry, for example, the date of starting period of smoking, which might have caused the time to death. And another aspect, some censored aspects are like right censored when we do not know the date of exit, such as date of quitting smoking, etc. So, that is also not the typical feature of ordinary regression. Hence, whatever we discuss, we can present here with in a systematic, in a structured format in a table, regression type, related variables, estimation techniques, etc. When the dependent variable are continuous or quantitative, then linear regression model is suggested. So, independent variable may be quantitative or may be qualitative. So, in that case OLS is applied. In other cases, there are several possibilities for the nonlinear regression, like dependent variable might be binary, might be categorical, might be ordered, might be repeated binary, okay, might be count, might be duration, as we already discussed. However, the independent variable could be qualitative or quantitative. So, estimation techniques are suggested differently when it is binary, linear probability model, LPM, logit, probit are suggested. Then in some cases when it is even truncated model is also suggested, depending upon how far it is actually censored. Then in case of categorical, that is qualitative variable, we usually suggest to apply multinomial logit or probit and some other interpretation of logit and probit through logistic regression also model. Wherever some aspects of marginal effect is also important, you may follow from our paper. We have a number of paper in this direction. Ordered case, cumulative logit and probit. When repeated binary is there, we suggest to follow panel logit or probit. In case of count data, Poisson regression is suggested, and sometimes it is called hurdle or two-step model. Okay, even in Poisson you can write it down, Poisson regression model. Poisson regression. Okay, in some paper you will find negative Poisson regression model also. You just go through those paper. And for the duration, some of the aspects, some of the model are suggested, like survival or duration analysis. Sometimes Cox proportional hazard model is also used. Now we are discussing emerging research designs. In the recent times, applied health economics has seen increasing research focus towards identification of causal impact on the outcome of interventions. So, those are considered to be policy variables or based on certain treatments. Hence, identifying causal or treatment effects is often illustrated using the potential outcomes framework, as mentioned by Robin 1974. However, in many times in observational data, observed relationship between outcome and treatment can be misleading due to unobserved factors and reverse causality, rendering the relationship of endogeneity. Okay, so for example, in assessing the impact of health insurance on healthcare utilization, it is likely that the omitted variables reflecting the demand for health insurance that may also partly explain the observed positive relationship between health insurance and healthcare utilization. It is also possible that higher healthcare utilization may be associated with having health insurance as well. In this case, the analyst must find a source of variation in the treatment that is independent of other factors that influence outcomes. Such sources of variation are mainly derived from the experimental research design, famously known as randomized control trial, and with certain freedom, quasi and natural experiments are also applied. So far as RCT is concerned, these are considered as the gold standard for evaluating causal impact of an intervention. In a RCT, participants are randomly assigned to either a treatment group or a control group. So, treatment group that means receiving the intervention, whereas the control group where no interventions are applied or given. For example, clinical drug trial of the COVID-19 vaccine, which also we discussed in our earlier chapter. In case of random assignment, researchers control the assignment of treatment or exposure but it simultaneously requires some aspects such as balancing unmeasured confounders. Properly conducted random assignment balances unmeasured confounders between groups that minimizes the bias. So, another aspect of this is also called control group. RCTs always include a group that is called control group, which may receive a placebo or the standard treatment. Okay. So, placebo which have actually received no treatment, hence we can actually have a clear comparison. So, we can refer to the work of Jayapal, okay, and recent works of Banerjee and Doflo. Esther Doflo, okay, who have received Nobel Prize using these. So, example here I am just mentioning that a group of researcher conducted an RCT to evaluate the heterogeneity in blood pressure response to 4 antihypertensive drugs. The method they have taken is participants are randomly assigned to different treatment periods, including a placebo washout period, and their blood pressure levels are measured during these times. Findings from that work is that the trial revealed significant variations in blood pressure response among participants, emphasizing the importance of personalized treatment approaches. Refer to the study of Sundstrom et al. 2023 latest work and Mann et al. 2023 cited here. I think that will also clarify you this further. Another important aspect is called quasi or natural experiments, where the situation mentioning quasi experiment where persons are assigned to a treatment or multiple treatments and a control group, but the assignment is not fully randomized. In other words, quasi experiments have a source of randomization, that is as if randomly assigned. While not explicitly controlled by researchers, they approximate randomized designs. Hence, it has some features like natural variation and less susceptible to bias. Quasi experiments leverage naturally occurring variations such as policy changes, events to create treatment and control groups. In theory, as per the less susceptible to bias is concerned, quasi experiments are less susceptible to bias than traditional observational designs. Some examples we are just putting it here on this ground is on a government implemented a new tax policy affecting the price of sugary beverages, as mentioned in by the author Backholer et al. 2018, want to analyze health outcomes such as obesity rates before and after the policy change to assess its impact. The method taken was like researcher conducted a quasi natural experiment by comparing health outcomes before and after of the policy change. Here they analyzed regions with stricter taxes and regions with milder restrictions. Okay, so the stricter taxes they are referring to as the treatment group, whereas the mild restriction is the control group. So they find that the tax policy had small effects, okay, small effects on health outcomes, particularly the on obesity rates, although noticeable but not that substantial. We need to note here for further clarification is that while quasi experiments and natural experiments both aim to assess causal effects, the key difference lies in the assignment process only. Natural experiments rely on naturally occurring variations, whereas quasi experiments involve intentional but imperfect assignment methods, as mentioned in DiNardo. You can refer for further details. Here to sum of different research experiment design, these have their objectives, participant assignment, control group, confounding considerations, level of evidence, advantages and limitations. So, experimental study using randomized control, and the second column is on the quasi experimental study. So, you can see the control group is particularly is strongly defined in experimental design, whereas in quasi it is not always required. Okay. Confounding it is important in the quasi experiments, whereas in case of experimental design it is not considered, but few claim as mentioned by Manson, you can refer that work. So, level of evidence etcetera is also different, you can just see other things. I think coming to the limitations, especially the RCT is highly expensive, it has ethical constraints, and generalizability is a major issue since it is based on a particular setting, whereas the quasi experiment have lower ranking due to lack of randomization, susceptible to bias and confounding as well. So, you can refer to the work of Chowre G 2020 for further clarifications. It is on quantifying health. Let us discuss about post experiment estimation technique. These are also important post experiment estimation techniques, starting with panel data methods, and then matching and reweighting estimators, DID difference in difference method, instrument variable method, then regression discontinuity designs. So, these are considered to be post experiment checks. So, starting with panel data method, we also discussed to some extent in earlier modules. However, as a post experimental panel data method involves analyzing data with repeated observations on the same entities over time. The entities may be individual firms or countries etcetera. The methodology usually considered as fixed effect or random effect. Fixed effect were controls for individual specific effects. By including the fixed effect, maybe here is dummy variables for each entity, that is individual and firm. This captures time invariant characteristics unique to each entity. Since we are not taking the random one, hence it is actually time invariant. Whereas in case of random effects model, this assumes that individual specific effects are actually not fixed, they are actually random and uncorrelated with the regressors, and this also accounts for both time invariant and time varying characteristics. That is why this is also important given the context. The study by FC Guarnez 2015 quantifies the combined effects of the expansion of primary healthcare and conditional cash transfers on infant mortality in Brazil 1998 to 2010 using fixed effect estimation. Another post experimental techniques approach is called matching and reweighting estimators. These estimators are used for addressing selection bias in observational studies. It is a quasi experimental method in which the researcher uses statistical techniques to construct an artificial control group by matching such treatment unit with a non-treated unit of similar characteristics. One of the most famous matching techniques is propensity score matching technique, where the matching method is quite important. So, for the propensity score method in short called PSM, matches treated and control units based on observable characteristics, reweights again to the observations to create a pseudo randomized sample. This the use of the cases such as evaluating program effectiveness when random assignment is not feasible, improving causal inference in non experimental settings. Some of the examples of the PSM you can follow our own paper, we published it. This is our actually hypothesis where we research question where we discuss whether having a social network affects individual healthcare expenditure. So, it was published in 2022. We use the data of India's Human Development Survey ISDS of 2011-12. The treatment variable were social network, and the control variables we considered as age, sex, education, place of residence, household expenditure per capita and information index. So, for the PSM, we applied PSM in this paper, where we match individuals with and without social networks based on observable characteristics. Balance covariates were also taken to reduce the bias. The findings in this paper of ours is how individuals with social networks have lower out of pocket expenditure compared to those without. Hence, social network play an important role in assessing the healthcare information and reducing cost. It has strong policy implications because improving social networks and the information dissemination would really mitigate to a great extent of the out of pocket expenditure of the individual and the households in India. Another post experimental technique is called DID, difference in difference method. DID is a quasi experimental design that uses longitudinal data. That's important to note. Earlier in the previous method, we didn't say that. It's not longitudinal data is not required. It was in one period time. Even applied. So, longitudinal data from treatment and control groups to estimate causal effects. It is commonly used to assess the impact of specific intervention or treatment. Methodology of this DID is like comparing outcomes before and after treatment for both treated and control groups, and this estimates treatment effect as a difference in difference approach. So, the uses of these will be in evaluating policy interventions, especially for example, the health impact of changes in tobacco prices. Analyzing natural experiments are important, as you already mentioned. So, the specific examples and reference you can follow for further clarification of DID from this paper by Tirgil and others. Of the very latest one published recently in 2023 that demonstrates the causal impact of family medicine reform on patient satisfaction in Turkey using DID. Another method is called instrumental variable method. Usually this is quite important for controlling endogeneity and omitted variable bias, OVB. In short, it is called IV methods, usually describe endogeneity and omitted variable bias. An instrument, that is exogenous variable, is used to predict treatment assignment, estimates causal effects by exploiting variation in the instrument. You can refer to our paper. I am just citing here Haile for further clarification, and Mohanty, okay, published in a top journal on migration and remittances. This is based on work is based on Ethiopia. Okay, so published in 2022. So, we have discussed about what should be a right instrument. Okay, so how far the instrument techniques are suggested, how to check that is actually exogenous enough. So, estimates causal effects by exploiting variation in the instrument. Then some use of this is like estimating causal effects when direct manipulation is not possible. Correcting for endogeneity in economic model is must and usually suggested, especially in panel model. The endogeneity is expected to be very huge, where in cross sections it is, since it is a particular time period, response are taken. Hence, and considered to be, and most of the cross section variables are considered to be having fixity in response, used to be non dynamic. Hence, endogeneity is expected to be lesser, whereas in case of panel model it is usually suggested to apply IB method with the possibility of some endogeneity within it. So, we discuss about test how to check that there are endogeneity or not. You can refer to our paper as well. Even the study by Dean and others 2015 established the impact of HIV status knowledge on linkage to HIV treatment in South Africa using the IV approach. So, the last post experimental technique at this moment we are discussing is on these regression discontinuity designs, RD in short. RD design usually evaluates treatment effects near a threshold. Here participants are assigned to the intervention and the control conditions based on a cutoff score on a pre-intervention measure, and that typically assesses need or merit. So, the methodology used for it, like this explores outcomes around a cutoff point or the eligibility criteria, and this compares units just above and below the threshold. So, assessing program impacts near eligibility threshold is important for policy or for programs evaluation. Identifying causal effects in situations with clear rules are also important. The study by Jabor and others of 2017 showed the causal impact of HIV treatment on mortality, employment and education in South Africa using the regression discontinuity design approach. So, that is all I think in this module, and the following two lectures will be on data handling packages in healthcare and in health. We discuss in the next two lecture on especially emphasizing open and licensed data handling packages that will be also useful for a researcher to know and apply. And I think you can refer to the specific papers. So, our own paper we have highlighted here as well, and it is its title. And for instrumental variable you can also refer, as I told, our another paper by Haile and Mohanty. Okay. So, on remittances flows. So these are all for today, and I think these references are extremely important for the researchers. Whoever have already have some experience, they will be also benefited out of it. So, I think that is all for today. I expect you to listen other two lectures will be equally important. You can also suggest other to follow. That is all. Thank you.